Hello, I'm Dr. Dudley Harris. I'm the founder of the San Antonio Eye Center. I'd like to introduce you to my good friend and colleague, Dr. Sora Hahn. Dr. Hahn went to school in Colombia, and she did her internship and residency in Colombia. Then she moved to the United States, and she did a residency in ophthalmology here at the University of Texas Health Science Center. She joined my practice in 2009.
Mr. Harris, I'm going to be examining your eyes now. Can you please come forward and bring your forehead all the way to the front? Very good. Very good. Now look straight ahead to my ear. Very good. Look up, please. Very good. And down. Very good. Look straight ahead again. Good. Now look straight right here. Very good. Very good. I'm checking the pressure of your eyes, Mr. Harris. You're doing wonderful. Very good. Now you can sit back. Very good. Okay. Mr. Harris, so based on our exam today, I think that you have a little cataract and your vision is about 20/30 on both eyes. So, well, I wanted to hear from you. How much is this really bothering you? Because the cataract, yeah, is there, but it's still very small. So I would like to hear from you.
My only problem is driving at night, and I can work around that.
Right.
I don't go out quite as much. I try to stay away from heavy traffic.
That's right.
And I think I can carry on as I am.
Good, yeah, that's what I thought too, because I think that your cataract is still a little bit small, so I think that we can still wait and probably, just using artificial tears when you're reading, and probably, well, we can check and see. It seems like with a different pair of glasses you could see just a tiny little bit better, so I think that we can wait and see. You can of course always call me if you have any difficulties, but if not, then we can see you back again in a year.
Okay.
Very good.
Okay, thank you. People are often curious to know how a doctor chose to become a doctor in the first place, and how the doctor decided to become an ophthalmologist, or what specialty to go into. They're also curious to know, how does a doctor keep up with the field that he or she has chosen? How do they study? Can they speak Spanish? And what do they feel about the practice of medicine? In this video, you're going to hear the doctor talk about those questions. And you're going to come to know who this doctor really is.
So my interest in medicine didn't start right away. When I was a little girl, I was interested in many things, usually always regarding to science or also social sciences. I was interested in that too. But not until I got into 9th grade and we were going to do a little project with a frog. We were going to dissect that frog. I think that was the moment when I knew that I wanted to be a doctor. And the reason was that at the beginning I was a little bit scared of the animal, and I found it a little bit repulsive, quite honestly, the appearance of the animal. But once I got into the project, I became so interested in that, and something kind of changed at that moment. I felt like a little surgeon in opening the body of that animal and seeing the organs, how they worked, how they interconnected between each other. I found it fascinating and it mesmerized me, and I think that was the moment when I thought, oh, I want to be a doctor. When I got into medicine, I thought that I was going to be a pediatrician. But when I started doing my surgical specialties, I loved that. I loved the fact that I could fix something actually with my hands. So every rotation, I thought that I wanted to become, a doctor in that particular specialty first. So for a while, I thought I was going to be an ENT doctor, and then I thought I was going to do orthopedics. But then the rotation in ophthalmology began, and I loved the fact that it was so visual, that you could really see what was going on with the patient. You didn't really need that much, the words of the patient, or to imagine what was going on, because you actually could see really what was going on with them. And then in the OR, I thought that it was fascinating to see when I saw my attending taking out that cataract that in those days was an extracapsular surgery, and he took the whole cataract out, which was like a little lentil, and it looked dark brown. And then instead of that, he put the most beautiful piece of clear plastic inside of the eye, and just using the fingertips, he was suturing, put 10 sutures with a suture that was finer than a hair. And looking under a microscope, using his hands so clean, bloodless, oh, I fell in love with it. And that's when I knew that I wanted to be an ophthalmologist. Well, I think that I'm very fortunate because I married an ophthalmologist too. So although it seems, some people say that it's boring to bring your job to your, to your house, I really find it great to converse with him about ophthalmology. So we go together to meetings, which we enjoy a lot, and we read a lot too, and we keep on talking, and a lot of our friends are also ophthalmologists, so we talk a lot about ophthalmology at home, but basically reading and going to meetings. In my case, my training was a little bit different from the traditional training that American doctors have, because I graduated from Colombia, from Bogota, Colombia. And so I did my first residency in ophthalmology in 1997 and graduated in the year 2000. Then I was recruited by the University of Southern California in the year 2000 actually, and then I was involved with a very interesting project. It was the largest population-based study in ophthalmology done among Latinos. That was the Los Angeles Latino Eye Study, and I learned a lot. We saw 6,000 patients. We gathered a lot of data and learned a lot about the eyes and diseases of the Latinos. Then after that, I started my residency, my second residency in ophthalmology here in San Antonio in the year 2005, and then graduated in 2008. And I've been working with the San Antonio Eye Center since 2009, I believe, and so it's been about 4 years. Mm-hmm. So when I go into the operating room, I have to say that that is my favorite part of my profession. Is the day that I relax, and it is really like doing a craft. I really enjoy it a lot. I enjoy the fact that I can, with my hands, fix something. I like it a lot. I enjoy it. One of the things that I have enjoyed the most about being an ophthalmologist was when I had the chance of doing missions, medical missions, when I was back in Colombia. And there are so many wonderful memories. I think that is just a nice mixture of feeling that you can make a difference with people who work together and volunteer their work, their time, their money to do something for people who really need it. I thought it was fantastic. There are so many great memories, but probably one of my favorite ones is when we were doing cataract surgery on an old lady. She had cataracts, very mature cataracts on both eyes, and she couldn't see anything. And she was a very, very nice old lady. And I remember doing the cataract surgery, and then the next day when we removed the eye patch, the smile in her face, although she was toothless, it was the most beautiful smile. She just hugged me and kissed me, and she said, "I can see." And that to me was beautiful. And that's probably one of the memories that I treasure the most. Hola, yo soy la doctora Sora Hahn y hoy les voy a hablar un poco acerca de la retinopatía diabética. La diabetes es una enfermedad muy común en los Estados Unidos que, si no se corrige adecuadamente, puede causar daños en su cerebro, en sus riñones, en su corazón y en sus ojos. Afortunadamente, con un buen control de los niveles del azúcar en su sangre, esto se puede prevenir, pero los niveles del azúcar varían bastante durante el día. Por eso, la mejor manera de saber cómo está su diabetes y si está bien controlada es chequeándose la hemoglobina A1C o hemoglobin A1C en inglés, que es un test que su doctor hace cada 3 meses. mantener una meta de la hemoglobina A1C de 7 o por debajo de 7 disminuye significativamente las probabilidades de que usted tenga daño por la diabetes en los órganos que anteriormente dijimos o mencionamos. Recuerde que no necesita hacer grandes cambios diarios, pequeños cambios en su dieta, en un buen plan de ejercicios diariamente y tomar las medicinas, por supuesto, pueden ayudarlo de manera muy eficaz para controlar su azúcar. Cuando la diabetes causa daño en los ojos, puede causar daños en las paredes de las venas y de las arterias que están en la retina. La retina es el tejido sensible del ojo, se encuentra localizado en la parte de atrás del ojo y es como cuando usted va al cine, es la pantalla donde se proyectan las imágenes. Esta es la imagen de una retina normal. En esta foto podemos ver que pueden haber pequeños cambios como estos pequeños sangrados y estos exudados que ocurren porque las paredes de las arterias y de los vasos ya no son fuertes y no pueden contener la sangre. Afortunadamente, existe una manera de tratar estos, can you do that? Can we do that part after we did the...
Sure.
Yeah? Okay.
Okay. Why don't you take it right from where you're setting the pictures down, because I'm going from a zoom in to a zoom out, okay? Mm-hmm. Give me just 1 second. And action.
La retinopatía diabética o daño en la retina puede no darle ningún síntoma. En otras palabras, puede que usted no sienta ningún problema aun si tiene daños en la retina. Por eso, la mejor manera de saber si usted tiene retinopatía diabética o daños en la retina por la diabetes es teniendo exámenes periódicos hechos por su doctor de los ojos. Afortunadamente, si usted tiene daños en la retina, se pueden tratar. Existen tratamientos como el láser y algunas medicinas que pueden ser aplicadas en los ojos que pueden ayudarle a detener la progresión de la enfermedad. Okay. My duty as a physician, I think that being a physician is a huge privilege. I feel very, very fortunate to be a physician. So at the same time, I also feel a big responsibility because I think that I need to convey, I have the responsibility to educate my patients on how to take care of them and explaining to them what I see, what I know about their diseases and how to help them to improve their quality of life. I think that that's probably my main duty, to educate and educate myself too daily to help the patients see better or to feel better.